My name is Helen Haskell. I am head of Mothers Against Medical Error, which is a patient advocacy organization that I founded along with other mothers after the death of my son, Louis. Louis died from medical error. I think Louis was a bright star that arced across the sky.
His story resonates on all levels in the healthcare industry.
And it's not just Louis. It's thousands of people every year. It is a huge loss to society. We're squandering life, we're squandering talent.
I think the importance of it is that it continues to remind us of how fallible we are as healthcare providers. We went into medicine to heal. None of us went into medicine to hurt people. Louis's story reminds us that what we can do, our job is now to make it better.
So we started with legislation, the Louis Blackmon Act, which is a patient safety act for hospitals.
When the Louis Blackmon Act came along, I think we were really focused initially on what would be the impact of that legislation. As we tried to start developing a statewide quality and patient safety program through the Hospital Association, we saw a wonderful opportunity to sit down with Helen and move past just what legislation needed to happen, but how could we work with her as a true partner to really have meaningful improvements in quality and patient safety in every hospital in our state.
They started with the Patient Safety Symposium, and he wanted to have an awards ceremony. It's always been wonderful. It's really so meaningful to have that. A student was nominated, and we realized, oh my goodness, we need a separate award for students. Our first Louis Blackmon Student Award goes to a young man who is Louis's age, a fourth-year medical student at USC, and that is Ross Hilliard. This was Ross Hilliard doing the sorts of things that we could envision Louis having done. So I see these young people as his ambassador, going out into the world and doing what he can't do anymore.
I think the importance of that award is it seeks to activate people at a lot of different levels. On one hand, the student award may feel the most valuable because we're equipping a future generation to think differently and look through a different lens, and that's powerful. On the other hand, we can't wait for their generation to come and change the way care is delivered.
An unbelievable story that Sekou Andrews wrote about a baby in a womb and the feelings that were going on there, and that was dedicated to Louis.
I was just fine without you people. I really was. I was curled up in the complacency of my cocoon. I was 8 pounds of equanimity nestled in the serenity of my womb, my own prenatal comfort zone.
We had several performances, and when we employed them, they didn't realize this was in honor of Louis. And one of the main performers had been in a performance with Louis when they were little.
Louis and I grew up together. We used to do theater. First show we ever did together was Snoopy the Musical. We really only had a few years worth of a friendship because he died so young.
I've heard it said that people come into our lives for a reason, bringing something we must learn, and we are led.
He touched so many lives, and he was so young.
He was only 15. He did not get to make his mark on the world.
We should do everything possible within our powers, individually and collectively, to make sure there's not another Louis Blackmon.
This is my attempt at a substitute, and it's a poor substitute because he was one of the shining lights of our state.
Everywhere we go, people ask, what's different in South Carolina? Why are all your hospitals doing this together? I think we have our own catalyst event as a community of hospitals, and it was Louis Blackmon.